Thank you for your time and interview, Dr. Badger. So, I would like to learn more about this study. Would you talk about the background and how you got to be interested in this issue?
Okay, so the article that we're talking about, the study we're talking about, is Helping Others Heal, Burn Survivors and Peer Support. And the background for this, or the catalyst for why I wanted to study this, is that peer support is the use of peer support is growing in supporting people through a number of different adjustments in life, including those things that occur in healthcare. It's a great example of the use of mutual aid as an intervention. And in burn care specifically, it's growing in support for its use and actually its utilization, but there isn't a lot in the research literature about the use of burn support in burn care. And what is available is more anecdotal or based on satisfaction ratings or those sorts of things. So an exploratory study such as this seemed to be a good place to start from a quantitative perspective to look at how burn survivors perceive peer support as a helpful or potentially beneficial intervention in their healing.
I see. So, why did you choose quantitative methodology over qualitative for this one?
Well, actually, I did both. We did both. Dr. Royce and I did both, but we wanted to get some sort of more of a quantitative understanding about what variables might be influenced by peer support, which would then guide qualitative research and additional quantitative research. So we actually planned a two-prong approach, and so this was a piece of it. It really felt like we needed to try to attempt to understand the interaction and the correlation between peer support and quality of life, social comfort, reintegration variables, those sorts of things that were really prominent in the literature. So it was a place to start to explore that for informing future direction.
Mm-hmm. And what was the most challenging thing when you did this study?
Well, as you can see by the article, the response rate that we received in this study was 29%. And actually that was higher than a previous study that used the same sample. The study used a sample from the Phoenix Society for Burn Survivors, which is a national support organization for anyone involved in the burn community. And it's traditionally the rates have been low, so we were concerned about the response rate. And also we couldn't find measures in the literature that were specific to peer support. Peer support in general, quantitative measures, peer support in general, but also specific to burns. So we did create a measure, and so that was something that we needed to do. And peer support in general, if you look at, this is mentioned in a systematic review, peer support is often offered in conjunction with other interventions. So to isolate the effects of peer support is very difficult. And as is true with any quantitative study, there are lots of variables that can impact the result that you'd want to know about, but you don't want to burden the responder so much with multiple pages of things to fill out, so we had to make choices as to what variables we included.
I see. And how did you become interested in this population, the burn survivors?
Well, I before my position here at University of Kentucky, I worked in a pediatric burn hospital for 12 years. And then as a social worker, direct care social worker, and then I went on to manage a medical division of social work in a trauma center. And while there, in both those places, I saw the power of peer support for burn survivors, and I was also involved in trying to bring in a peer support program for burn survivors when I was a manager. And what I found is that when I went to the literature to find data to support the efficacy of the intervention, I could not find a lot specific to burns. So when I moved into this position at University of Kentucky and I formed my research trajectory, I actually went back to my practice experience and to my very consistent and strong interest in burns and used that to formulate my research plan. And also I was interested in assisting the Phoenix Society. I respect that organization. It offers wonderful services. In being able to investigate this from more of a research perspective and to help them more fully realize that branch and that part of their mission. So I've been working very much in conjunction with the Phoenix Society. There's a World Burn Congress, which is an event that the Phoenix Society sponsors every year, and burn survivors are able to, and their loved ones are able to get so much support from each other. And the power, I've attended that for many years, and the power of peer support was very evident there from an observational perspective as well as hearing burn survivors describe it.
I see. And why do you think the research is important in social practice?
Well, peer support, as we mentioned in this article, peer support very much exemplifies values in the social work profession in terms of utilizing a strength perspective, building on individual self-determination, and being able to empower those who are vulnerable or who have suffered or experienced some sort of event that we wouldn't expect to happen, to be able to empower them to be able to receive help from others similar to them and also to help others. So I see it as an intervention that allows us to, as social workers, to affirm value in having experiences and to be able to draw on that and draw on people's abilities to support one another. I think also social workers, like for example in healthcare settings, are in the position to be able to link burn survivors or others in need of support with these community resources. And sometimes we think about those that are formalized or those that are offered by professionals, but there's a very different perspective that peers offer. And it's a nice complement to professional intervention. So I think social workers can be advocates for that and be champions for making sure that burn survivors are connected with peer support. And sometimes there's access issues to professional intervention, either proximity, financial, that sort of thing, availability. And I think peer support, especially through a national organization that can do web chats or pair people throughout the country with someone who could be helpful with them, that's a nice way to be able to extend support where it might be limited in other situations.
Mm-hmm. And do you have any comment or advice for future social workers or program evaluator, our students in the CSD concentrations?
Well, I think a couple of things I would mention with this. One is that this is my understanding that I've developed in working with burn survivors, is that there's so much strength and resilience that come with the burn community and burn survivors that really can benefit others and can be explored and shaped into a major resource. And I think sometimes we think of traumas or catastrophes as being life-changing in negative ways or depleting ways, but there's also a strength that comes from that we can be looking at as a resource for communities. I would encourage future social work researchers to look at opportunities to develop evaluation plans at the same time that they are developing program interventions, whether it be at a group level or at a community level, so that you are definitely linking the research with the planning of that intervention, and you're using results to inform the development of programs. But also think about how, from a community standpoint, you can address challenges such as access and proximity to care, financial limitations, those sorts of things, when you detail those interventions so that you are able to reach as many as possible and as many people as possible and supplement what might already be there. I think there are populations and problems that probably get more attention than others in the literature, and I want to encourage future researchers to consider populations that struggle or that have challenges that may be a minority or may not be as evident right now in research. For example, burn survivors have a unique set of needs, but there's also commonalities that you can share, that they share in terms of having experienced a trauma. But their unique needs should also be researched and represented in the literature.
Mm-hmm. So what make you pursue more advanced degree in social work, and what make you decide to do social research?
to actually to go on and get my PhD
Yes.
to make this change?
Yes.
Right. So I worked in, how long was I in social work? I was in social work for many years. But while I was working in the pediatric burn hospital, I was in a setting that really acted on their research and patient care and educational mission. So I really got involved in research as a practitioner at that time. And I began to teach at that time. And I realized that I loved that. I loved the exploration. I loved being able to follow up on things I was very interested in, and that I would limit my students if I didn't continue my own education. And I really wanted to be able to have a solid foundation and the skills necessary to investigate, to do social inquiry and investigation. So I did decide to go on for my PhD, and the sad part about that was leaving the burn care focus. I went on to manage in medical, and I loved that. But when I thought about then how will I actually use the research time, I really wanted to return to what I loved. And I had grown to respect those who work in burn care and really appreciate what was involved in recovering from burns, and I wanted to stay connected to that and to be able to add to our understanding of what is necessary to support burn survivors in adjustment and recovery from a research position. When I began my position here, there was a professor in the college who was retiring, and he said to me at his retirement party, which was the same week I started, to write what I know, to use my experience. And it's very simple. It seems so obvious, but that made it made so much sense to think about truly how can I take my experiences of almost actually it was over 25 years as a practitioner and use those to inform my research efforts. And I think that doing that helped me to really understand how I should approach this as a researcher, because I had the practice experience, and I draw from both worlds.